Welcome back to another episode of My Therapy Room. I'm your host, Cindy Ettienne-Murphy. And today we have a very special guest with us, Tina Ross, an expert in child psychology. Our topic for today is attention deficit hyperactivity disorder, commonly known as ADHD. Welcome, Tina.
Thank you, Cindy. It's a pleasure to be here with you.
So let's start with the basics. What is ADHD?
ADHD is a neurodevelopmental disorder that affects both children and adults. It is characterized by difficulties with attention, hyperactivity, and impulsivity. Individuals with ADHD may struggle with organizing tasks, staying focused, remembering instructions, and controlling their impulses.
So are there any specific signs parents should look out for if they suspect their child may have ADHD?
Absolutely, Cindy. Parents should be aware of certain signs such as consistent difficulty paying attention, excessive fidgeting or restlessness, difficulty staying seated, talking excessively, and impulsivity. It's important to keep in mind that all children may display some of these behaviors occasionally, but if they persist consistently and interfere with daily functioning, it could be an indication of ADHD. Well, first and foremost,
Thank you for clarifying that. Now, let's dive into the main theme of today's episode. How can parents help their child manage ADHD?
it's crucial for parents to seek a formal diagnosis from a qualified healthcare professional, such as a psychologist or psychiatrist. Once a diagnosis is confirmed, a multimodal treatment approach is typically recommended. This includes a combination of behavioral interventions, educational support, and, if necessary, medication.
That makes sense. Could you elaborate a bit more on these different approaches?
Behavioral interventions aim to teach children coping strategies to manage their symptoms and improve self-control. These often involve setting clear expectations, establishing routines, providing positive reinforcement, and implementing strategies for improving organizational skills. It's essential for parents and teachers to work together in creating a consistent and structured environment.
That sounds like a collaborative effort. What about educational support?
Educational support involves creating an individualized plan for the child within the school system. This may include additional resources, accommodations, or special education services to help the child succeed academically. Open communication with teachers is critical to ensure the child receives the necessary support. Medication.
Now, what about medication? When is it considered and what should parents know about it?
It is typically recommended when symptoms significantly impair the child's functioning and do not adequately respond to behavioral interventions alone. Medications for ADHD can help improve attention, reduce impulsivity, and enhance overall self-control. Excellent question.
Thank you for clarifying that. We're running out of time, but I have one last important question. What can parents do to support their child emotionally throughout this journey?
Excellent question. Parents play a crucial role in supporting their child with ADHD emotionally. Here are a few key strategies they can implement. Firstly, it's important for parents to educate themselves about ADHD. Understanding the condition, its symptoms, and common challenges will enable them to be more empathetic and better equipped to support their child. Secondly, maintaining open communication is vital. Parents should create a safe space where their child feels comfortable expressing their feelings, fears, and frustrations. Regularly checking in to listen and validate their concerns helps the child feel understood and boosts their self-esteem. Absolutely. Active listening is key.
That's a great point. Are there any specific ways parents can improve communication with their child?
Absolutely. Active listening is key. This means providing undivided attention, paraphrasing what the child is saying, and ensuring they feel heard. It's crucial to acknowledge their emotions without judgment. Additionally, parents can use visual aids, such as calendars or visual schedules, to help their child understand and manage time. This reduces anxiety and helps the child develop a sense of control. Dr. Tollard.
What about balancing discipline and understanding in their approach?
While discipline is important, it's equally vital for parents to understand that ADHD often affects self-control, impulse management, and attention span. Parents can work on creating structure and routines to help their child manage their behaviors more effectively. This involves setting clear expectations, providing reminders, and gradually introducing age-appropriate responsibilities. Dr. Tollard.
So along with structure, are there any other strategies parents can implement to support their child's emotional well-being?
Teaching the child to identify their strengths and affirm themselves regularly can help build resilience and self-confidence. Parents can also assist in identifying their child's interests and hobbies, which serve as outlets for them to express themselves, build self-esteem, and navigate stress.
That's fantastic advice. Thank you once again. And to all our listeners, remember that you are not alone in this journey. Stay tuned for more episodes from My Therapy Room. Thank you for listening.